Welcome to the Department of Orthopaedic Surgery and Musculoskeletal Medicine. If you're looking for some way of improving your clinical acumen, if you're looking for a research opportunity in musculoskeletal medicine, if you're looking for a way to improve your clinical skill set, you're in the right place. We believe our department offers excellent opportunities for learning within health sciences. We have postgraduate programs in musculoskeletal medicine and pain.
This was the first course in the world of its kind, and it still is. And it's strongly supported by postgraduate students.
This is the only program in New Zealand that is a pain-oriented program. Postgraduate certificate, postgrad diploma and master's program. We have a large number of clinicians who work within our department, and I'm immensely proud of what they contribute to the department, both within clinical research areas and our basic regenerative research areas.
The PhD gives you a whole new range of opportunities that even I hadn't thought was possible, and I'm really lucky because I'm able to do the things that I love, which is research in the area that I love, which is spinal cord injury, right here in the University of Otago. Hi Brett.
Afternoon.
Thanks for doing this. So you remember this questionnaire? We have a great link in the university with people who work between the university department and the hospital, so we have an amazing opportunity to be able to access the real world research environment while we're doing our projects.
One of our main goals within the department is to improve the opportunity to expose students to research. We have a major research theme in regenerative medicine, basically centred around articular cartilage and the development of articular cartilage models.
We're trying to make tissue constructs and tissue engineered constructs, and this is something that you can actually hold and see in your hand, but the idea is that this will go back into the patient and help the patient improve their quality of life.
So you could imagine that if someone had diseased or osteoarthritic knee joint, what we would like to be able to do is to take the patient's own cells and look at regenerating all that damaged or diseased tissue, so you end up with a living joint replacement, if you will.
We hope eventually that we'll be able to translate that research into patients, and there Burwood Hospital will become a major area where that type of translational research will be undertaken.
Burwood's a great place to work. It's a real area of expertise. We've got the spinal unit, we've got experts in brain injury, we've got orthopaedic surgery and rehabilitation happening, we've got world-class clinicians and staff.
If you wish to come to Christchurch, it's not just research that should attract you as well. We have a beautiful environment here in Christchurch where people who are involved in sporting activities excel. If you're a biker, there's plenty of bike trails to bike on. If you're a runner, there are plenty of running trails.
So the thing I really love about Christchurch is that it has everything. You can be at the beach, 5 minutes later you're up in the hills, the same day you can be up skiing at Mount Hutt. It's got everything that you want for an outdoor lifestyle.
With the rebuild in Christchurch and the new Burwood Rehabilitation Hospital, as well as the new rebuild of the Christchurch Public Hospital, we have amazing facilities.